explain? I think we have a graphic to show our viewers, and it is somewhat uncomfortable. My husband has this, and he always tells me this is awful.
So the foot can have an arch, and the arch is basically when you're standing, it's the inside part of your foot that's got some space. You can put a finger, or, it's a small space, and depending on your genes, some of those spaces are bigger or smaller. And I liken it to height. Some people are short, some people are tall, but most people are what we call within normal height. And most people are normal-footed, including people with flat feet. Now, there are severe cases in which people are way too tall or way too short, and those are pathologic. Same thing with the foot. There are cases where the foot is just too flat or rigid, or the arch is way too high and rigid, and those can cause problems. But by far, most feet are normal, even the flat ones.
Okay, and why does it happen? It's genetic?
Genetic.
That's it?
Yep, ligaments, we call it ligamentous laxity, and the ligaments and the support structures are just a little looser, and so when you put weight on it, your arches fall to the ground.
Does it lead to problems, or is it that you just need a shoe with a special insert?
Sure. For the most part, it does not cause a problem. We determine whether a foot is normal by its flexibility and not motion flexibility by the fact that it can form an arch when it's being used. So if you look at your kid and they go on their tippy toes and they form an arch when they use their tippy toes, that means their foot is a flexible flat foot. Now, those kids with flexible flat feet can get into trouble if they have tight heel cords or tight calves. And if that's the case, they can get arch strain, so they will say, "Mommy, we're walking in Disney too much and I have to rest," or they can get some pain. And for those kids, a little insert can help with that. The other reason is they wear their shoes in faster, so if you're buying expensive shoes, an insert can help decrease the wear.
And this is not something that you can outgrow, right?
So most babies are actually born with a little bit of a flat foot.
Right.
And depending on your genes, you will get this arch or not by the age of 7. But there's nothing that we can do to make that process happen any faster. And if you give them an arch support and they have an arch in the shoe, that's not going to make it any faster either if they're going to have it. It's just genetic.